Hi everyone, Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragal Medical. This week we're going to be talking to you about conservative treatment options for patients with lower back pain. If you or a loved one are suffering with lower back pain, especially if it's radiating down into your legs, you're definitely going to want to stay tuned. We're going to have a lot of great information about conservative options here at Maragal Medical. Stay tuned. Okay, Dr. Mike, I've noticed the last few weeks on my consultation, we've been getting a lot of patients in with lower back pain, some patients that have experienced an incredible amount of pain with radiating symptoms down into the leg. And oftentimes they'll tell me that their primary care physician has set up a consultation with a pain management doctor. Should they keep that appointment? And I kind of let them know that, you're in an office where Dr. Marciello is a lower back and spinal specialist as a physiatrist. So let's talk to the group today about conservative treatment options that we have for lower back pain, because we can make a huge difference with these patients.
Well, again, if you remember, back pain is so common,
Yeah.
and we all experience it in some way or another. But again, the person who has that acute flare, person who can't move and has a concern about a sciatica or things, this is what we want to do to start. It's a treatment that needs to be done conservatively to start, for sure. I think the primary care doctors are overwhelmed, they're seeing too many patients, and they immediately think, okay, go to the pain clinics, go to the spine specialists and things. But that's why we joined together, because combination of chiropractic and physiatry is the perfect model to remain conservative, get the person under control, and move forward with getting their back feeling better. Whether it's the joints, whether it's the disc, whether it's just a muscle strain, all those things are what we do to get a person back going. And if they have a little bit more difficulty and they don't recover so quickly, then we can do the next levels as well. Get the x-rays, get the MRI pictures, and do the things that we would need to do if things don't want to resolve, but kind of conservatively.
Yeah, and I think the public just needs to understand we got a great resource in your abilities. You're a spinal specialist here in Leominster. So number one, we're going to get a very accurate diagnosis because your physical exam is so thorough. And then we're unique because we're an integrated medical clinic. As you said, we've combined medical care, physical therapy, and chiropractic treatment under one roof. Particularly for the spine, chiropractically, between Dr. Dave Sherman and Dr. Rebecca Brooks, we specialize in a form of traction called decompression, where we have the ability with some special equipment to gently stretch the spine out to get a little better range of motion. That's particularly important for patients with disc injuries because a traditional chiropractic adjustment may be contraindicated or too painful. So we want to make sure that we're utilizing more conservative techniques. And then, my wife, Colleen, she's our physical therapist. She has the ability to make sure she goes through, evaluating the patient and addressing their flexibility and their core strength issues as well. The best part is you and I really think outside the box. We're looking at conservative treatment options and then really cutting edge treatment options on how we can help these patients. So in the form of arthritis, once things have settled down for these patients, those regenerative injections can help repair, some of the damage that's associated with arthritis to prevent it from getting worse overall. So a lot of great treatment options that we have here under one roof.
They really are, and the concept, again, people are always worried about a disc. Most times the person has some degeneration, but it's really not a disc problem that they're really needing to come in for. It's the chronic wear and tear, the process of the spine breaking down, and that's what this conservative program is doing. It's looking at the musculoskeletal imbalances, looking at the degenerative joints, the aspects of movement or the lack of movement when a person is not keeping up. So once we do get those acute flares under control, now we can implement some of these extra treatments and remind people this is something you need to stay on top of. And we don't need to be going to these big procedures with the pain clinics for cortisone injections and things that are really sometimes not necessary.
And can make it worse over time.
It might make it worse when you get them done too frequently,
Yeah.
for sure. But if we just think nature will still take place, but we can help speed that up in a conservative way, now we get you saying, okay, I feel better, what can I do to try to prevent it or reduce the times it happens again? And that's what we're here for.
Yeah, that's great. If you or a loved one are suffering with lower back pain, you don't want to hesitate. You're going to want to give the office a call as soon as possible. More information can always be found on our website at maragalmedical.com. And we've got some great resources with our YouTube videos. Please consider subscribing. Best part about it, we take most insurances. Well, that's it for today. I hope you learned something, and have a great day, everybody.
Take care.